Good afternoon, everyone. We're going to get started. My name is Melissa Harvey, and I'm the Program Manager for the Community Entity for Rural and Remote New Brunswick, as well as the City of Bathurst, and I sit on the National Alliance Board to End Homelessness for Rural and Remote. The City of Halifax is situated in Mi'kma'ki, the ancestral and traditional lands of the Mi'kmaq people. So for today's presentation, you can't end a problem you can't see. The first presentation in this session will speak to the importance of defining rural and remote homelessness in order to properly address it, while the second presentation explores using survey data to inform responses to rural homelessness. We'll then hear from a local initiative that incorporates data into a shared leadership process of community development and inclusive engagement of local organizations. Some things have changed with the people that are presenting. So the first three will be giving their own biography. And the first person, Aidan Kavitso from the YMCA of Amherst. Thank you.
Thank you. So I'm joined here today by a self-proclaimed pack of nerds. So Kristen DeJarle and Julia Woodhall-Melnick. Kristen, do you want to say just a few words about yourself and your work?
Sure. So I'm an assistant professor of sociology at Cape Breton University. I study homelessness, housing, and health, and I'm grateful to be here to help support Aidan in his work. But he is the expert here.
Yes, just like Kristen, I am a sociologist. I'm an associate professor at the University of New Brunswick in St. John and Canada Research Chair in Resilient Communities and founder and director of the Home Research Lab. So Home RL, look us up. We're fun. Aidan is the true expert here. I study housing affordability and homelessness.
Right.
And I'm a nerd.
Yeah. Thank you, guys. So today we're going to be talking about our service-based count. I'm going to try and give as much community context to rural communities and how data collection differs than some typical point-in-time counts that a lot of people hear about. Being that I'm from my work out of Amherst, Nova Scotia, I live in Sackville, New Brunswick, but I work in Amherst and I'm relatively new to the province. So tackling rural homelessness and housing issues is something that's relatively new, but also rhymes with a lot of parts of the country. I'm originally from Thunder Bay, Ontario, and finished my BSW in Amherst and decided to stay because I love it. So some of the goals. The presentation today. This is a little bit of an itinerary. I mean, these are just prompts. I think a lot of times it's really helpful when we're having conversations and discussing things as they are and not just as some sort of abstract concept. So one thing we want to talk about is the definition between urban and rural homelessness. I mean, we recognize that there are differences and how it presents is different, but how do we move from treating homelessness as a definition from a rural perspective and an urban perspective and be able to count and enumerate and then put that data to use in further policy initiatives. And also, when we're talking about policy initiatives, we know that has to be from the community. We know that top-down policy doesn't work. Those initiatives don't work. Purely market-based solutions don't work. And so how do we leverage the information that we can get and we know anecdotally translate it to something that's usable that'll move us in a direction to eliminating homelessness. So a lot of what people are familiar with are point-in-time counts, and they are done in urban centers. They are often done in 24-hour spans, and they're meant to enumerate people who are actively and currently experiencing homelessness. What they often aren't able to capture are people that are on the bubble, people that are on the brink or at risk of homelessness. And I think that throughout this week, we're hearing about how more and more people are at risk because of inflation, because of poor wages, because of poor housing choice, severe skyrocketing market rents. But in a lot of ways, homelessness in a rural setting can look different than an urban setting. We know that in rural areas, we know our neighbors, or we don't. If we don't know our neighbors, we know about our neighbors, and we know what's happening at our neighbors' homes. And so a lot of people that are experiencing homelessness become hidden because they're using their kinship or social networks to support themselves. But what happens when those social networks or those kinship networks dissolve and are exhausted? In bigger cities, those same networks don't exist in the same way. I think a lot of the community connections that are made within the people that are experiencing homelessness are built once they're already there. And what ends up happening is when those connections in rural areas are exhausted, then that's when we see an increase in service provision stress. And that's where, like I said, Mike, most of us heard this week already, there's a lot of downstream effects of increased service stress on staff, on resources, on funds available. But in some of the ways that they are similar in that people are homeless for a multitude of reasons that are intersectional. And a lot of those intersectional ways are the same no matter if you're in a rural and urban setting. But what changes is how we measure that and how we define what that looks like. So we're all very familiar with couch surfing. And one thing that we see a lot in Cumberland County and in the town of Amherst is trade. So whether that be sex trade or drug trade or labor trade for a place to stay. And we also have lots of people that are tenting and not in the same way that I know down the road here in Halifax, there's a tent encampment that was situated by the city of Halifax, where a lot of tents that are happening around Amherst and Cumberland County are on the edges of properties, on the people's backyards. They're agreements with people. Sometimes they're not agreements. Sometimes they're just hidden from businesses and from people that have larger pieces of land that they just aren't walking their property all the time. So how do we count those people? And it's usually when they interact with services, when they need something. So this is where our service-based count tool comes into play. We try and enumerate people by also engaging our service providers and our partners. So currently right now in Cumberland County, my office at the Y, as well as we're partnering with Nova Scotia Health Authority, and Julia is helping us with her lovely pack of nerds at UNB to do the data analysis for us for our current service-based count. And it's happening from November 1st to November 30th. So service-based counts often happen over a month span because we want to allow people to come to service and be counted. And people aren't counted in real time and asking questions of these people. This is done with a waiver of consent, typically, and in a way that you're not asking these questions directly to the client. We're not re-traumatizing. And a lot of times what we're trying to do is also get the information without impacting that person's access to service. Because once we have a trusting relationship with somebody, we don't want to jeopardize that by trying to ask questions where people might just get their backs up and say, well, where's this information going to go? Or is someone going to call the cops on me? Like, where is this? What's going to happen to me? And so it tries to address the structural barriers that happen as well in rural areas. So no transportation. Cumberland County has the Cumberland County Transit system, but I think it's a van. It's one van and you have to book it far in advance. And that service is actually being stressed because of the new service that Nova Scotia Health Authority put out, where they will pay for people's appointments, pay for travel to people's appointments from rural areas if they can't make it, which is a fantastic service. But in Cumberland County, it is one van. And there's other taxi services that people can request, but it's not perfect. And I know that rhymes with a lot of different rural areas in Nova Scotia, as well as across the country. And so by engaging our service providers, we also are able to measure how many service providers people are contacting. So if somebody's at the food bank, or if somebody's at the library, if they're on income assistance, if they're using the local shelter. Amherst last year was our first year with an overnight shelter, and it was only for the winter. I was on the task force group that helped organize that and run it. And now the Cumberland Homelessness and Housing Support Association runs their current shelter. And thankfully, they have some great staff that are doing that work. But prior to that, people had to rely on those kinship and social networks. So another piece of this is community collaboration. I think I've heard all the last 2 days about partnership, partnership, partnership. And I think government always says partnership, 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 no silos, right? And so it is a really key part in your communities to doing this work and doing a service-based count is to have buy-in from other partners. And, in larger urban cities, like I think about somewhere like Toronto, where you have boroughs and you have neighborhoods, and they're kind of unique. The work that they're doing is unique to each part of Toronto based on the community there. So it would be really difficult for someone in, I'm recalling my Toronto geography, Etobicoke to be connecting with people in Scarborough. They're on opposite ends of the GTA, but also facing the same issues, right? So in smaller communities, it's really important to have those community connections. And so this is where I will call on my nerd pack to talk a little bit about the definition and giving context to what it means to make people who are invisible visible.
Hi, everyone. I'm not going to stand up because, again, Aiden is the show today. I think one of the things we need to remember whenever we're defining something or creating policy, definitions make some things really visible and they make other things really invisible. And when we create something like a pit count or a service-based count, we have to be very conscious of what we are making visible and what we're essentially shrouding, right? So when I say things are invisible, I mean that if we decide the only people we're going to count are people who are unsheltered, we've missed a huge piece of the story, right? Like we've made that invisible. We've made that so those people, quote unquote, don't count anymore. And so when we think about a service-based count and why we need a rural definition of homelessness, and we're not going to give it to you today, it's still in process. But what we're moving towards is a more holistic kind of understanding of, one, how these relationships contribute and how they help us to understand a more complex type of homelessness than we talk about in most sort of pit counts and in most ways in which we're measuring people who are experiencing homelessness. And two, recognizing that some of the pressures that we're experiencing, and again, lots of places in Canada are experiencing housing pressures. We're not minimizing that. But I think rural settings, it's often more invisible because those pressures become things that aren't counted. Like people move into the city instead, and then they commute far if they have to come into the rural center. And is that homelessness? Kinda. Or if people are underhoused, right? I'm sure everyone's heard of like 12 people living in a tiny 2-bedroom apartment. And that, again, current definitions don't account for that. And yet it's a phenomenon we're seeing, I think, also in the urban centers, but a lot in the rural centers, especially where stock is falling apart and what's available is very low quality. And that's one of the complications, I think, of rural homelessness and something we need to bear in mind.
Great, thank you. I'm also not going to stand up as I am a supportive nerd and not the show. So just to kind of pick up a little bit on what Kristen was saying, there's also the nuance in there too that we experience throughout the Maritimes of the rural urban fringe. So when we think of, and I was like Aiden, born and raised in Ontario in Hamilton, and moved here about 6 years ago. And when we oftentimes from that Ontario context, when we think like urban, we think, massive Toronto, Hamilton, even like Waterloo would be like small urban, right? Or a mid-sized city. So out here, our large cities, I'm looking towards Halifax would be the biggest one. But, in New Brunswick, we have cities of, 100,000 people that comprise the largest cities within the province. Some of these cities have significant student populations as well, too, as do many of the actual rural areas in Nova Scotia. We have, Wolfville, Acadia, CBU, so in Cape Breton, and that also puts a very different reality and pressures on these systems. So by being able to reach out to services to find a way to track folks and then see where they're accessing services and what they're accessing, we can also see how we're underserving them as well too. So it provides more than a count. It provides us with an imaginary of what we need to develop. And we can also look, because we're going to be, and this is where the data nerd comes in, we're going to be linking folks and through different services. So everybody's going to be assigned a little unique ID, and then we're going to say, okay, Joe went to the library today, then he went to the Y, then he went to the food bank. We can also as well see how people's service use interacts, right? So we can better meet them where they're at in terms of providing some of these services. And we all know that we hear that the experience of homelessness is exhausting. I think about everything that somebody who experiences housing insecurity has to do every day just to maintain their well-being. So being able to have these opportunities to look for intersections of where services can come together to, take some of that strain of going to this, there, and the other service location really speaks to something I'm excited about as well. So the whole experience is really complex when you do look at some of the factors, especially local here in the Maritimes.
Thank you. I think what I mentioned at the top about people being on the bubble and the ability of a service-based count to capture people before they're homeless. One of the criteria as part of our tool, and we've created our tool in tandem with CBU and with Acadia and other folks that have done multiple service-based counts to kind of learn from what they learned, but also to compare our data. And so when you're trying to record people ahead of time, and saying, okay, what is at risk? What are the factors that make people at risk of homelessness? I think we can think of them anecdotally, but to try and capture them as part of the service-based count is really important for service provision, for planning, for trying to come up with some policies and public policy that leads us to prevention. Some of the stats that I have here, I pulled from the provincial housing strategy for Nova Scotia. I think one that is probably significant to me because this is probably one that I would also fall under is 93% of people that responded to the survey that was done said that they do not feel confident they could find a suitable alternative on short notice. And I think with vacancy rates below 1% in most parts of the province, I think rural Nova Scotia is lumped in to anywhere outside of HRM. So not individual communities are really measured well when it comes to vacancy rates. And so I think ours in Cumberland is equivalent to 0.9 to 1%. And that actually doesn't even speak to what the actual vacancy rate is. I would put it much below 0.9%, which is also, like I said, has service stresses in itself. For people that are working in good jobs, good paying jobs, trying to find housing, but also people that are on the whole spectrum of housing that require a safe place to be. So I think we're running close to our time. So I'll close it off here and say that using service-based counts has to happen in tandem with our point-in-time counts. It's not an either or. It's we know that if I think about GTA or HRM or other urban rural metropolitan areas, you have places just on the outer edges of a rural municipality that may not get the same resources that are in the city center, but are still part of that giant conglomeration. And so you need the PIT counts and you need the service-based counts. And so it's important to collect this information and really get a full capture picture of the spectrum of homelessness in our communities. And I think I'll leave it at that. Thank you.
Our next speaker is Rachel Bedingfield. She's the Director of Parks and Recreation.
No, sorry. It's okay. I've been called worse.
I'll let you take it from there then.
I wish I was Rachel Green, if anyone. But I'm going to laugh because I am standing, so I'll stand over here so you can see me. That's funny. I should maybe let you do your job instead of me. Okay. It's okay. We're like sisters now. Yeah. So my name isn't Rachel Green. It's yeah, I will be your friend by the end. And it is Brenda Mishak, and there's a microphone. Do I hold this? Does this work?
Yeah.
Oh, okay.
It's just you wanted to stand
Oh,
over
okay.
here.
Oh.
So
No. Anyway,
there's choice.
you can choose. I can choose. Oh, well, that's awesome. Okay, so still Brenda Bishak, and I am a associate professor with the University of Victoria, newly minted via Saskatchewan. So I moved from Saskatoon, Prince Albert, Saskatchewan to Victoria via Kitimat. It's a long story and COVID related, so here I am. Just wanted to acknowledge the land that we're on and my commitment to reconciliation through my work as a nurse practitioner and as a professor and researcher. A little bit of the outline. You can tell I'm pretty informal. We'll talk about who we are and the research team that we developed, where we've been, where we're now, where we're going. I always say the best laid plans. I think it was Mike Tyson that said, everyone has a great plan until they get punched in the nose. And that's kind of what research is like. You have a great plan, you have a wonderful grant, you don't get it. So there's your punch in the face. So these are our plans. Some of them have come to fruition and some of them are still seeds yet to bloom. So we really focused on data-driven decision housing policies. And in Saskatchewan, we talk about poverty in a global sense, and a lot of our literature from the government comes as poverty, and there isn't really as specific housing in the way that I would ask if anyone asked my opinion, what I would say. It's very broad and very nebulous, and it's hard to pin down policy when it's so nebulous. So it's easy for people to kind of skirt the issue and play that hot potato game that is housing with different jurisdictions. So our vision was to increase policies, information, develop policies, and inform different jurisdictions of government, including the local, municipal, and provincial, on the way we could advance housing security. And we really moved away from homelessness to housing security in our language to help with people and that NIMBY attitude. And I'm not homeless, it's othering. And we really tried to take away that ability for people to other others. I'm not experiencing homelessness, but I think if we asked anyone in this room, do you feel 100% absolutely housing secure? Never worry about it. Never wake up at night. My kids are fine. My parents are fine. Everyone is fine. I don't worry. I don't think anyone would feel 100% housing secure in this room. So we really tried to change that language. This is the dream team, and slowly but surely, people are graduating from their programs. We have Riley. He has graduated out. He does his master's in social work. Candy is a PhD student who's now flew the coop. She's doing her studies. So I'm working now with three fourth-year nursing students out of University of Victoria, and we're working in northern BC, Kitimat and Terrace area, and I'll get into that. Jason Mercury was part of the initial grant application, and he started as the acting director of housing, and as time progresses, he's now the director of social infrastructure, huge portfolio. So this started in 2019, which gives you an idea of why we've had some changes. As a provincial group, we met with academics, community organizations pre-COVID, you'll note the date, which did impact the way the money was coming out finally. 2 years ago, we received applied for grants. We received the money, $10,000. So a small little pocket of money to do some great work. And the funding is ceased as of now. So we received a little bit of money. I also contributed my own salary to the project. And universities have this opportunity, I use in quotes, because you're given the opportunity to invest $15,000 of your paycheck into research. So that's what I did to move this along. We worked with the Métis Nation of Saskatchewan and the National Council of Women of Canada, and we chose to partner with the NCWC, which just had its 123rd AGM, I believe, in Saskatoon. And we partnered with them strategically because they have federates with the national, provincial, and municipal governments so that we can leverage those three different governing agencies and bodies. We had to start from scratch, so we had to develop an advisory committee, and because we wanted to research housing, security, and homelessness across Saskatchewan, we invited representatives from cities, MLAs from the Saskatchewan Association of Rural Municipalities, First Nation, Métis Nation Saskatchewan, and academics and people interested in the cause of us. We did a literature review, so I've read thousands and hundreds of articles. We hosted a think tank. I'll get into the Back to Batoche and our data collection. We met throughout the year. Our last meeting for the advisory committee is November 23rd, just coming up. And lots of thank yous to give. The advisory committee really did help hone in on the questions of the survey that I'll get into a little bit. What we found, as most of you have, the literature really did show that affordable housing, imagine that, a leading cause of housing insecurity, support services, and the number of like Swiss cheese holes that have to, they all line up, and someone is at the end of that Swiss cheese hole. Partnerships, we talked about that for the last 2 days, and the importance of partnerships, and research and housing insecurity. And really, sometimes it gets a little bit of controversy with private sector investment. And I've been on the other end of some LinkedIn comments that I thought, you dare say that to me in my face, about supporting some type of private-public partnership. Like, the reality is we need to work together every way we can to make this a better place. So what we did with Métis Nation Saskatchewan and that big advisory group was we, through literature, found the Rural Development Network, and I'm smiling because Emma and Kylie were very helpful. And we worked with the Rural Development Network on the survey that they've deployed twice in Alberta at that time. And the survey was really rural-oriented and Métis informed, which was important to us. We went with the advisory board. We did do full ethics review at the University of Saskatchewan, which was a process of nothing I want to do again, but I will do it again if I do this research again. It was huge and time consuming, and we did it. So we're really proud of that. We have received obviously the preliminary data, and we're reviewing it. And it's this was our Housing on the Homeland was our project, and we're wrapping it up in the next little while for data analysis. There was some glitches and there was some learnings, and part of it is the using an app without internet was interesting. You were able to do it. I love IT, guys, I really do. And things should work. We know what should do. So the app should work. It does, but it wasn't user friendly. And what happens when you're stressed and the app doesn't work? Like, you become like raging. So we did get it to work. It worked fine. And then we were able to poach internet because the cell towers didn't work because there was 40,000 people blew the cell towers. They couldn't keep up. So there was lots of those things that it should work. Well, yeah. Research in the community, people weren't all that enthused about completing a survey. Imagine that, a survey at a celebration, and we didn't have good prizes. That was my other, like, oh, we didn't even have a good prize. So this is, I'll tell you, this is my mom in the middle with her proud Métis bag and her new beadwork, and my sister's birthday, and my niece who just finished her Master's of Education. I'm wearing the ribbon skirt that my sister made, and stay a Métis sash apart for COVID. I thought those were pretty much what we did there. The interesting thing we found was and I posted these pictures of my families, because when my family was around the table visiting, that's when people came to fill out the survey. I thought, this is so interesting on how people don't want to miss out on something. It's like a bar and they like pretend there's a lineup, so you stand there in line, right? I couldn't have been the only one. So it was like that. It was like as soon as we had people coming and visiting, then others wanted to come in and chit chat and see, what is this about? And then we started talking, and we did some small group where, like, say, friends came and they kind of sat together and we walked through the survey together. And that really helped with the uptake. Having conversations with people. And so we kind of had a open-ended question at the end, and then we just typed up what people responded as. So that was really helpful for us to kind of keep in real time what people were saying. We had lots of lessons learned, and we just texted each other. This is what I would do different next time. And then when we got back to the office, we had to like read all these like one sentence texts instead of trying to write them on a piece of paper and lose them. So we did a lot of texting of our lessons learned. One of the biggest takeaways is having more of the community partner engagement and support. But the community partner didn't want to look like they were collecting their own data to make themselves look good. So it was one of those conundrums almost, like what do you do? So we'll keep working on it. What we found was just the preliminary analysis was accessibility, affordability, and suitability. And I think we mentioned it just recently, like just now, was the suitability of housing and how you may have a home, but it's not suitable for you, whether it's aging in place, children with unsafe stairwells, those kinds of, like, the suitability is there. And that's not a luxury to me. That's a suitable home is your home. It's yeah. The need for community awareness campaigns. What we found was in the responses that people, when we asked, does your community have these services? Many people replied, don't know or no. But then we knew they did provide those services. So we thought, oh, there's a lack of awareness of what your community actually has. So that was an interesting finding. We found that a comprehensive housing support program to enhance the accessibility, affordability, and suitability across the housing spectrum. So not at one end or the other, but throughout the entire spectrum of housing. And the respectful engagement to really open that dialogue, ensuring a safe space. So these are some of our preliminary policy recommendations for anyone that's listening. We're really wanting to ensure that housing stability, provide housing supports for those in need, promote the diversity and encourage mixed housing. We talked about that yesterday. Enhance supportive services and improve the community knowledge of the supportive services. Increase affordable housing and really be creative in ways to increase affordable housing options. And then improve the transportation. You mentioned that. Food security and community gardens. Enhance transportation, housing accessibility through local resources. So that was one of the projects. The other part we did was with the National Council of Women of Canada and a think tank we hosted. And I just put the questions on here because we didn't go through full ethics review because of the way the questions were worded. So that was a big, it was late when I received a message from ethics and said, we need a full one. I'm like, I don't have time for this. So what way do I have to ask the question? So that's why I put them in here. So these are specifically worded so you don't have to go through full ethics review. So where are we going? Prairie to Pacific. So as a side note, I'm a nurse practitioner with Correctional Services Canada, and we talk about the Prairie region and the Pacific region, Atlantic region. So this is my tip of my hat to Correctional Services. So because I moved physically from Saskatchewan to Kitimat, BC, taking the research with me and going back and forth was starting to get a little bit, you're kind of a fly-in researcher, and that's not right. From my perspective, for me, it didn't feel right. So then I started working in Kitimat and building community relationships where I live. And a wonderful community. It's very, it's a working community. It's developed around a business, right? Alcan. If you buy aluminum foil, it's Alcan. And then in Terrace, which is another, it's only about an hour away driving, but they're very different communities. So we sort of developed into going into Kitimat and Terrace, and then working with the University of Victoria as associate professor. It just fits better than trying to work in another province. So now we have 3 fourth-year students working on housing and housing insecurity. And I think some of the greatest insights come from the young people that were, one is from the north, from Prince George, but the 2 other students were right from Victoria, and they've never really been out. And they were surprised at the lack of supports and services past a certain geographic line of Kelowna, Kamloops in BC. They were shocked, and just, it was like the light bulbs went on that they've lived a sheltered life. I'm like, oh, great. I'm glad you saw that. That's what university's for. So these are some, we're doing our job. The community partners that I'm working with in Kitimat is the Tamatik Status of Women. The district of Kitimat itself has been, there's a mayor and council, and one of the councillors has been phenomenal to work with. And in Terrace is the Kisan Society. 5 minutes. So we're moving in that direction and looking at building relationships and partnerships and trying to fill some of the gaps that the community identifies. So preliminary, it's looking towards transition housing for people leaving custody, carrying transitions with the uneven path workshops coming up. So that's pretty much exactly where we're headed. And in Terrace, we'll see. It's all evolving as we speak. What else could I say about them? I had Spark BC out there. Spark BC is reviewing our application. I'm quite positive we'll have some funding coming from Spark BC for both of the community projects, and we can keep the lights on, as they say. I did want to say that I wanted to come here today to encourage any community organization to really talk with their local university. I see Cape Breton, UNB. I thought they were from University of Northern British Columbia. I was like, oh my gosh, they're not. They're not UNBC, they're just the UNB, but that's okay. So really do work with your community partner. Like if you're a community agency and you have a question or you have a need, phone, contact, email, whatever you have to do to get to a university professor. We are here to service our communities. Let's be real, like not all the way, but we're here to provide a service for you as a community member, as a taxpayer of this country. That's what universities are for. So do access your university professors and your supports that are out there, because we're here to serve. We're not here to, as some people say, navel gaze or ivory tower, all that philosophy stuff is great, but at the end of the day, we're here to serve you as the community. So do reach out to your university and ask for supports, advice, facilitation. You might get it for free instead of hiring a highfalutin consultant from some far off land. Okay? You promise you'll ask a university? Okay, good. There. I'll say short and sweet, but you knew that already. There's the references for all those university students that are making sure I did it right. They're APA.
I know those eyes. No.
I know, we're good.
No. Yeah. Come on, let's take your picture.
Hi, everyone. You might have noticed in your programs that I'm not listed as a presenter, but I'm Olivia Pattison, and I'm here with Nancy Stewart and Rachel Bedingfield. Nancy and I are both health promoters with Public Health in Nova Scotia, and Rachel is the Director of Parks and Recreation with the town of Kentville. and we all work work to support the work of the Homeless No More initiative and movement. So why I'm here is that we really decided to change how the format of our presentation was going to be. The way that we envisioned things might look a little bit different than what it is right here. I'll kind of set the space of how we would like you to experience our presentation. That would be us kind of sitting together in a space with also an empty chair that I'll talk a bit more about later, just to kind of give the feeling of how we do our work together. So that's a bit of what we wanted this to look like and why we changed the presentation format. Originally, we were looking at coming up and speaking to you, kind of like I am right now, but that didn't feel totally authentic to our process. And we really wanted to share how our work is relational and really working together and having conversation. And we used a pause and decided that it's okay a week before the presentation to like throw the whole thing out and start over. So that's what we did. And we're here to do that. And we hope
You're
it
doing
goes
great.
well.
You're amazing.
So we do also try and be really intentional in our work and bring our whole selves. We're not going to do that right now because we only have 20 minutes. But we also encourage you to think about how you can bring your whole self to the work that we do in housing and homelessness, and to really think about how you can invite others to also do the same, because we can't do this work just as who we are, maybe in our work lives or volunteer lives. It really involves bringing your entire self into that space. And we did intend on having an empty chair here with us as well, to be symbolic of and represent those who aren't here with us today. We're a small piece of the work that's happening in the Annapolis Valley of Nova Scotia, and also to represent those who might join at different stages of the movement and those who we haven't met yet. The table and the entry to this work is really collaborative and always open. So connected to that, today we are going to, through our story, share our process of the approach of how we do our work. And we are here to share about and demonstrate the process more than, the content of our work. So in that, I'm going to be asking Nancy and Rachel some questions to help share the story. So to start, I'd like to ask, what and who is Homeless No More?
Thanks, Olivia. And I want to start by saying I'm really excited to be here as a pack of nerds. It's a lifelong dream come true. Homeless No More is a movement in the Annapolis Valley in Nova Scotia. So like our friends from Cape Breton, it's about an hour outside of Halifax, and it is a very rural area. And we have this shared leadership model of folks who are constantly and passionately trying to end homelessness in our area. We've had 6 years of experience so far with a lot of success really quickly. We're really happy about that. A lot of it was timing and just the way that things lined up. And we are really, I think, touched by the comments earlier of this experience of rural homelessness and what that is. That's very distinctive. And we're really happy to be able to share a bit of our process, which we're already modeling, just sort of going on the fly, but having that relational piece.
Absolutely. Nancy and I don't really do well unless we can make eye contact with each other. It's just part of that piece around, hey, how does this make you feel? How does that sit with you? So when we were practicing, we thought, oh, this feels really foreign to how we actually do our work. So I appreciate Olivia jumping in at the last minute, though I'm sure that we may have to buy you dinner later on. We'll see. I think it's really important too that we talk about the diverse partners, and I'm using that word intentionally because I know on the slides it says stakeholders. And once we submitted those, for those of you who haven't presented here, you have to submit your slides a week in advance. And this is real time where we check in. That word actually doesn't feel great, does it? So we change it to diverse partners in our notes. And this is, again, an example of how we do our work, where we're constantly reevaluating our wording, how things sit, how they feel, whose voice is being heard, whose voice is not being heard, all of these pieces.
And that's an intentional piece of our work. So we hold space every time we come together, every conversation that we have, even within emails and that sort of thing, to really have that grace to pause and to reflect in the moment and continually to really embody the way that we are modeling. We want this work to happen and hold space for the work that is calling us in to do that. So it's very much bringing that whole self to the work.
Yeah, and we use that phrase a lot. What are we being called to do? What is the work calling us to do? And we'll talk a little bit more about that later. The one thing that I have here, we do have notes because otherwise we go off forever. And Olivia, that's her job, is to knock us off. We're continually working to disrupt the way that that entrenched colonial norms influence the way we're expected to do our work, and that is really intentional. We've gone halfway through a session or a process and thought this is not who we are, and have backed right off. It's really important to create that space to be able to do that if we're going to move forward in a way that is leading with equity with the people that we're working with at the center of that model.
And we're so lucky to have so many people on our journey. We're two people representing a whole team of folks, several of whom are in this room. And we love and cherish all of you. And we have that respect and that trust in those moments for all of us to be able to challenge that conversation and to be able to help inform us so that we can enrich our process. Yeah. So thank you.
We have to keep looking at Olivia because she's going to stop us.
Yes, it is time. Thank you both. I'd love if you could share with us a bit about the story of Homeless No More.
Yeah, I can start.
Why don't you start?
Why don't you start? Okay. So again, Homeless No More is this movement, and Nancy said at the beginning that it's really, it's a shared leadership. It's not owned by anyone. We had this conversation at the beginning around whose logo should be on it, who's going to hold the website, who's going to hold these things. And it was really important to us that there is no one organization or one individual that is leading the charge. This is absolutely a collective way of working, and it's from a grassroots community of caring people and organizations. And that definition continues to sit throughout the entire process.
We've heard that a lot the last couple of days. We heard it earlier with our colleagues here. That partnership piece is so important. And we did hear from our community. So this is very much community-led. And we heard from community 6 years ago. Homeless No More started as Homeless No More for Youth. And our community were concerned that there were youth that they were seeing who were not adequately housed and were homeless and suffering. We also heard some feedback of folks who were concerned, maybe not so much in a caring way, but more in a NIMBYism, in a bit of a backlash way. So, painting the real picture. But by intentionally inviting all the community in, we really had success with certain sectors once they gained the understanding of why the youth were where they were and the systemic barriers, the systemic challenges that were set up to create this place for them. We really had some folks who began to see it through a different lens, which was, I think, one of our successes really early on.
Yeah, and that's such a good point because, again, people come to the table for different reasons, and that's okay. And if we continue to create an environment and the keynote said it today, that is, led by your whole self, led by love, then those people that thrive in that environment will continue to stay. And it's been quite impactful. The thing that shifted in the environment, again, we were talking about how we were originally came together to address youth homelessness, is that now you'll figure out why we're at this table. We needed data. And so we're from Acadia University is the university that is kind of leading the ability to collect that data, and the data showed that we needed to expand quite quickly, and that we needed that data in order to advocate, which I'm sure you can all agree with. Without being able to count, then you don't have anyone on your side.
So early on in the process, and Rachel and I have been there from the beginning, so from 6 years ago,
I wasn't gray when it started.
we we intentionally invited a lot of different sectors into the work. So some who are directly involved, or you think about homelessness and youth, you think of education, Department of Community Services, but then some less usual folks, some less usual sectors as well, trying to get that diversity of perspectives at the table. And we invited folks in with an intention that by coming to the table, you're representing that sector where there are some policy pieces that are not working so well right now, and how to kind of deconstruct and reconstruct that in a way that the policies that were keeping youth vulnerable and at risk, we could shift that. And so recently, so with our data, we've done 2 service-based and community-based homeless counts so far. And we have been show that this was not just an issue for youth, but across the lifespan. So we are now in the process of expanding our Homeless No More work to be across the lifespan, which was really important. And we're looking to do a 3rd count soon, inviting some of our partners in from Western Nova Scotia, with this dream, not in the too distant future, of a Nova Scotian, right? Count for Nova Scotia. Yeah.
Thank you both. And I'd like to hear from you around how Homeless No More works to create change together with and as community.
Yeah, thanks, Olivia. This is just how our meetings run. This is actually a really awesome question to answer, because all I'm telling you is what we heard from folks. Again, we don't come together, that these aren't experts that sit around the table. We don't claim to know anything other than what is in front of us and how to move forward. So throughout our whole process, we check in with the community, with organizations who support community, and ask them, what is it that how Homeless No More as a movement could best support you? So these are the things
and
that we
we hosted 2
That's right.
really
Yeah, yeah.
significant community engagement sessions
Yeah.
over the last year, where we had many, many, many people in the room that informed the way the work should go.
and continually checking in. So the first thing we heard was that, and I'm sure some of you can agree with this, but that amplify the work. So organizations that are doing the work are currently in a state of crisis, because the work in itself is a state of crisis. So there's no time to stand up and advocate. And so supporting organizations to be able to have their voices heard, to make sure that their words, their exact wording is the messaging, is really important. Connect services and resources is another one that they said they wanted us to do, to make sure that there's no duplication, that there's opportunities to collaborate on grants, and to better serve the people that are there.
Mm-hmm. The 3rd one we heard was influence policy, funding, and system change. So that, is a big one, right? That's big. And by doing that, we recognize that it's the policy pieces often in these structures that are impeding the work. And so with our 2nd engagement with the community, we intentionally invited representatives from all levels of government and all the folks who hold these policy pieces. And again, we checked with all our community folks to really suss out what some specific policy ask would be for all levels of government. So we had 2 for each level of government. So having folks come there with a specific policy ask was really strategic, and gave that focus of what are some of those first steps that we can take. And we'll be coming back with more policy asks. But that was a really incredible piece for the community to tell us if that's what would be impactful.
And the piece there too is that we had all 3 levels of government in the room, and the messaging wasn't, hey, now we're going to send you off for you to be able to establish these policies on your own. It was, we're here to support you regardless of who you are, what organization you represent. We have this messaging, and we need all of this to work together.
And some folks were already doing the work.
They were, yes.
You talk
No,
about
you
that.
talk about that one. You're better at that.
No, you
go
are.
ahead.
Yeah, you go ahead. You do. I hope we're still in the club of nerds. When we invited all levels of government and chime in, we heard back from a lot of our Indigenous-led folks who said,
Yep.
"You're doing great, but we're already doing the work. We've already taken this, and we're further down the field than others. So great, but we're already there doing the work," which to us was so important, so important.
Thank you. So what are the things that you wish people will remember the most from today? And for everyone, there's a QR code in case you would like a digital copy of a handout that has all this on it.
So
And there are some printed copies.
we have
that you can
some
grab
we have
as
some
well.
handouts here as a takeaway. I know we have less than 5 minutes now. But the first thing that we were talking about is listening intentionally to community with a willingness to adapt. Again, we don't have any preconceived notion that we know the direction that we need to go. What we know is what's in front of us, and we make decisions in that moment based on what we know. Know better, do better, be better. It's a motto we use. And on that note, expect and accept change, because this is constantly changing, and be open for opportunities, because there are lots of opportunities out there, and you need to be at a constant state of readiness.
And the community leads the movement via a network of all kinds of folks in community, members, organizations already doing the work with intentional diversity of our partners, which is really important to us as well. And creating that space, we said it before, to pause and reflect on the process, to make that really intentional, and to really work at deconstructing some of the problems.
I think the last piece there is consider utilizing and adapting models. We were, years into this work, and then someone said, "This sounds like a lot like collective impact." And we were like, "Oh my God, that's quite amazing." And I would say, who knew? We should have TM'd it. But I think we're shifting even within that. So we don't even consider ourselves trapped in a system that already exists, or a process that already exists. Again, we're leading with the information that we have in front of us, with the people that are around the table, with our community, and with our whole selves. And that means that's what we follow.
Thank you. And we have a little bit of time, and I'm going to ask you if you could each share one thing in final words that you'd like folks to take away. And also contact information for us is on the screen with another QR code in case you want to get in touch with us.
The key piece for me, and I say this a lot lately, is by waiting until we think we've got it all figured out, until we think we know every single step, we are actually creating and perpetuating the harm that has already happened. So for us to intentionally take that first step, and then pause and reflect, and then take the next step, that's been really important.
Have tissues at the table. Some conversations are hard. This is really hard work. We all know this. You're all in it. Have utmost respect. It is really hard. This is where the relational piece comes. We tried to create opportunity and a space for everyone to bring their whole selves to the table. To lead with empathy, to lead with caring, so that when things get tough, when failures happen, when mistakes happen, we sit in that uncomfortableness, and we always come back to the table because we've led with each other and we understand each other. With having relationships with the people around the table doesn't mean you have to like them, but it does mean that you have to have the respect to know that it's worth it.
Well, Aliak, thank you.
Just want to say thank you to all of the presenters, and now we can do the Q&A. I don't know if you guys want a microphone to get to, or if there's anyone that has questions. You got one?
There's also lots of handouts here.
Testing. Yeah, wow, that was quite a finish. And yeah, thank you so much for those powerful words. And thank you to all three presenters. I'm with the Rural Development Network, and we actually just finished our provincial, it's essentially a service-based count this past spring, and we just finished the data analysis and whatnot. So really a lot of your presentations really resonated with me in the work that we're doing. I have two questions. The first question is for Aiden and your team. I was just wondering, with your service-based count methodology, I know the definition that you guys are working on is still very much in the works and whatnot, but I'm wondering, when it came to analysis, or just with actually the survey itself, did you ask folks or community members to self-identify as experiencing homelessness? Really curious around the methodology surrounding that, because we've adapted our methodology over the years, because we were finding that obviously there's this huge stigma around asking a question like that. We still ask the question in a more sensitive way, but we also now do our own analysis. And what we're finding is when we ask folks to self-identify versus the analysis that we end up doing, we're finding quite a discrepancy. A lot of folks aren't self-identifying. So that's my first question, and I'm sorry. And then the second question I have is just for the rest of the panel. I'm just curious about the feedback that you've received from community members who are completing the service-based counts and what folks are saying. Thanks.
Oh, thank you for the question. For our methodology for the current count, we have a waiver of consent, so we're actually not communicating directly with people. It's purely based on some criteria, whether or not they're in Cumberland County, they're 16 years of age or older, and are they falling under 4 categories that are straight from the Canadian Observatory of Homelessness. So it's not something that we necessarily crafted ourselves, but it was something that when we were considering who to try and include, there was some changes from our 2021 service-based count tool. So I'd be happy to share that with you as well.
I thought about it. I mean, yeah, I'm gonna leave it there. I think for us, like we're also doing a chart review. We're doing ours. So full context. I'm the researcher leading the service-based count for Eastern Nova Scotia, and so that's Antigonish through Cape Breton. And we're not doing our next count until I think April, May is kind of when we're shooting for. I'm looking at Peggy and she's nodding at me. So she's on the count as well. So we asked the same questions. We've been debating whether to add something about whether it's a chart review. For those of you familiar with a chart review, that's the process we use. So it goes directly to the service provider. It asks them the questions of the clients they've interacted with in the last month. It's over the course of a month. And it asks them about clients on their roster as well as clients they've directly connected with. So we're not talking to clients at all. So I think that's a really important thing. That said, we're considering adding a question about why people know or whether it's inferred. Because like often, I think as a service provider, so much of what you know is in your relationship. And so much of what you know isn't necessarily spoken aloud. It's the things spoken between the lines. And I think I'm working with Dr. Catherine Leviton-Reed on this, for those of you familiar with her work. She and I have gone back and forth about whether there's something about professional knowledge, and Peggy was in on this conversation as well, whether there's something embedded in a professional knowledge relationship, how much you intuit as a service provider. Because I think there is something to be said for what service providers blatantly know, because clients tell service providers way more than they would the researcher in the room, right? I was a service provider 20 years ago. I have not done that frontline work for a while. But as the researcher in the room, I know I heard more when I was the service provider. And so I think there's something about like what you directly hear versus what you can intuit and what you think you know based on your professional knowledge of everything else you're providing for that client. And so we've debated a little bit whether this is a question we should be adding. We're still debating a little bit. So I don't know where that's going to land for us, but I hope that, okay.
Can I add to
your
point? Yeah. And I will say that when we think about how many different services that people are coming in contact with, we're anticipating duplicates. And some service providers will know more about clients than others, or people that are being measured. So that also tells you about the types of relationships that people have with the services that are available. And so, someone who's accessing mental health and addiction services, that caseworker will know more about that person's situation than maybe just stopping by the food bank. But maybe the depth and regularity of somebody's use of a service would give context to which ones are trusted services and which ones they trust less.
Anyone else for questions?
Yeah, what was your second question? I'm so sorry. I'd already forgot it. Do you want to ask? I'll repeat it once you say it, if that's, that's great.
Thanks. Yeah. And thanks for clarifying that as well, because I think when I hear sometimes service-based counts, I think of our service-based estimation, which is done obviously a little bit differently with different methodology and whatnot. But yeah, if it's not necessarily a survey tool that folks are completing, my second question was really just about, if you were getting any feedback from folks on kind of the process and how they were finding the survey, if it was the case. But
Okay, I'll let Aiden start.
This is like my first time doing a service-based count, and our results are being collected right now. So, or the surveys are being completed right now. So, but from learnings from our previous one, some of the same service providers are helping us. And when we were doing our training sessions to prepare people to fill these out, what we heard was a lot of nuance and trying to figure out people's situations. And so, what was different between this survey versus the previous survey really comes down to some of the questions we asked, but also, what was the experience of the service provider filling it out? How easy or difficult was it? What can they fill out? And so I feel like from a service provider perspective, sometimes it can be really daunting to be filling out multiple surveys with, and our tool has a lot more qualitative questions than just demographic. And hopefully that's what we're hoping to catch a little bit of that extra context with. But I think we'll probably find that it might be difficult for people to have the time to fill that out. But also, we're just really hoping for some richer context to people's lives.
So just to follow up a little bit, Aiden sells himself horribly short. He's actually doing the great work of following up with the partners every week as well too. So he has the surveys out right now, and you're following up, I think, every Friday, right? With an email asking how it's going, do you need more surveys, et cetera, just to try to maintain that question, because, we do understand that by giving these forms with all these open-ended questions, like, you really are taxing a service provider, right? So it's about, and that's, I think, speaks to Kristen's work with Catherine going back and forth on that debate of, do we add in this question, or do we try to stick to kind of more of the bare bones, so we're not now adding an extra burden there for response. So there's so much to consider, but I think having those close contacts is going to produce richer data than we would have otherwise.
We're going to move on to the next question.
I was just ask really quickly to that because I think it's important. Sorry. We've done this twice. And one of the biggest feedback we got was the second time service providers could fill it out electronically as opposed to paper. So right there, you've instantly made it easier for them as well. We were able to add some individual questions for our areas, which I think is significant too. And the trust piece with service providers that you know really well, certainly from my background in terms of working with the early years, for a lot of parents to be able to disclose certain things brings a real fear, a terror that children will be apprehended. So from all those trust pieces, I think that that's really important. And some of the data in the rural pieces where we're really small, you can't present the data of a certain size, right? Because it's too identifiable. So
I just wanted to say that one of the comments I received that hit me in the heart was someone completing it and saying how blessed they were.
Amazing question. Obviously, we got going here. So we're going to go to one question and then we'll have probably space for one more after that. Okay.
Hi, I'm coming from the county of Renfrew in Ontario, and we have lots of small towns located throughout. There is one city only because they identify themselves as having 10,000 people. I think they include the cows. But anyway, so we have no data, no count, so no pit count. That's never going to happen. We have no shelter. We are very, very small in terms of service providers, so we know everybody who does it. Where do you suggest we start?
I can start with this one because the town that I work in is smaller than that, and we have no cows. And we have a shelter, and we have a number of organizations that are supporting folks who are struggling. And I think it was already said here, we reached out to our academic institutes who are amazing and are looking for partnerships and understand the need for data and how important that is, because that's like their job. They actually get paid for that. So, but just so you know, it is a thing. So if you want to convince anybody that it's possible to collect data for small communities, Kentville, Nova Scotia can be your best friend.
So just to follow up on that comment a little bit, I was really glad when you brought that up. I recently had a consultant approach me who was going to take knowledge from me and then sell it to a nonprofit who they were billing. To which I then asked the consultant to get off the Zoom call, and then I spoke to the community. So we are publicly funded by tax dollars, and we want to do this work. We're often very busy, but we want to engage in this work with folks because it's meaningful to us. It gives us energy and life and relevance and something to do. So that would be my first thing. Would be, and I know Renfrew well, being born and raised in Ontario. That would be my first suggestion. My second suggestion, if you want to send me an email, I can give you my card at the end of the session. I know some academics in your area, and we'll connect you up.
Okay. My word here is done.
I'm just going to come up here and add something. I think too, piece of in the Valley, when we do our count, the first one we call the service-based count. And the second count was a community and service-based count. We got feedback that not everyone in the community felt that they identified as a service provider, but still had that knowledge and information. So they didn't feel comfortable participating in a service-based count. So we broadened it to community and service-based and included things like folks like rec departments and municipal staff and a very wide, broad group of partners. So think creatively when you're doing counts about who might have that knowledge. And approach like a very diverse group of organizations and people, I think is a learning that we had.
I think I would just say to include everyone in the community, and then you're not excluding. And like you mentioned, when you count something, you make something else invisible. I wrote it down. It was really wise at the time. But, so we all wrote it down. Yeah. So that would be my other suggestion is back to the person that said they hadn't thought about some of the difficulties others in their communities might be experiencing. It was a really humbling experience for some to complete a survey asking, like, have you in the last month traded sex for a roof over your head? Like that just doesn't compute to some people, but for some it's a lived reality. So I think asking everyone, especially if you're in a small community, then you're not othering. It's only for those people. Like all of us are in this together, and make that community action a community action. That would be my other thought.
Would anyone else like to weigh in on that? Just checking.
Keep going, it's okay.
All right, next question then. Hi, my name's Diana. I'm from Prince Albert. So
I knew it.
Yes,
I knew it.
yes, we met. We'll talk after. But I had a question. So our community entity is urban based, and you guys talked about connecting with different levels of government. So I also attended late, just to disclose. But like, how did you guys find buy-in from your municipal and your rural? Because that's one of the problems that our community is facing. Our demographic, like our census says we had 35,000 people in our population, but over the summer it's closer to 45,000. And a lot of the people experiencing homelessness have been reported to be coming outside of our community. So we're working with the University of Saskatchewan to try to do research around that. But tying in the rural homelessness with municipal homelessness might be a solution that we haven't really thought about. Also, I wanted to learn more about how you guys do a service-based account instead of, like, do you still go out in the community and look at people experiencing unsheltered homelessness? And if you do, would that be providers or researchers?
I can start with the first part of that question and then I'll pass it on. So what you missed is that I work for the municipality. And to be clear, the Homeless No More initiative didn't start with the municipality. We were invited to the table and gladly sat there, also wanting to feel useful, because municipalities see it as well, right? And I happen to be the director of Parks and Recreation. We see homelessness in our parks, we see it in our facilities, on our trails. It coming into borrowed tents in other years would have been used for camping, but they need a month return date on them. We see it every single day. We see people coming in and saying, this is the last water bill I'm going to be able to pay before I get evicted. So municipalities absolutely should be at the table. And that then is your link to the other levels of government, because it is the job of the municipality to partner with the province, to work closely with our federal partners, all of these things. And I'm really happy that it didn't start in government. And I'm really happy that we're not leading it. I'm happy that we're an equal partner at the table. And that is honestly the only way that this would work.
To give context of my office at YMCA of Cumberland, we provide housing support services, so helping people find apartments. We provide trusteeship services, so helping them with pay their rent and their bills on time to keep them housed, as well as providing financial supports to folks, whether it's arrears or first months or damage deposit. And so we see the population. We see people that are on the brink. We see people that are chronically homeless that we try and house and run into lots of barriers. And so our connection to community was already ingrained. And then I would say the town of Amherst, which is where we're situated, is a very unique place where a lot of service providers are very well connected with each other because a lot of us are neighbors. And so using the connections within the community and where people are working out of, and the things that they're passionate about, the things that the community is passionate about, also help grow those collaborations when you're reaching out to partners to say, hey, we need your help to do this. And I think what's interesting is that the town of Amherst is very bought into the work that needs to happen around housing and homelessness. And the county of Cumberland often is a little bit more challenging to deal with because sometimes and historically they have not seen homelessness in the same way. And I'd say that probably through COVID, it was a big wake up call for the town of Amherst, and more recently that the county is waking up to this because of all of the tsunami of pressures on services and systems to support people after COVID, but also the varying ways in which our economic world has changed is impacted in every community in Canada. And so the town of Amherst saw visible homelessness for the first time in the last 3 years, where it wasn't visible before. And in the county, they're seeing it now because there's buildings being condemned, there's new builders coming in, and there's new property managers coming in, and property conglomerates that are coming in from bigger cities and buying up. And we also have, through COVID, there's a lot of migration within Canada, and a lot of people came to Nova Scotia, including myself, after COVID. All of that to say is that sometimes you have to start with the people that are on your side and just start leveraging, because and then like our friends down the table here had said, you have to do it in the spirit of teamwork and collaboration. Yeah. Because otherwise you're not gonna achieve your goals. And as much as different levels of government might also, sorry, I know I'm talking a lot. Different levels of government might also not be as accessible right away. The more that you're able to create the momentum with the work you're doing, the more that higher levels of government will also see that, including with your partnerships with at the municipal levels.
Can I give one more plug too to give you an entry point? And Amherst has a great recreation department, so I'm assuming that they're at the table. The recreation sector in general across the country is having this conversation, right? Because we see it every day. It's costing us dollars if we just wanted to put it down to that factor. But your community recreation department that is located in municipal government or is housing municipal government is your municipal government's dedication and commitment to community. So that is the department that is best aligned to be a part of and arguably lead this work. So there's your in, because those people see it. You can tell them to call me.
Yeah, so shout out to recreation. I didn't know if Rachel would do that, but and during the pandemic, so I work with public health. So the pandemic, we were there. During the pandemic, recreation in our local community stepped up in a way for that crisis response that was second to none. So I think that shifted the conversation that recreation is having. The other piece, and maybe Aidan touched on it too, the difference between our urban centers in our part of Nova Scotia and the more rural, there became this initially this sort of tug of, well, do those folks live in the county or do they live in the town, and who's responsible? So what we made really clear really quick was the services that these folks need by and large are located in the town centers, the hubs, or that's where the services are. So for folks who are coming to the hubs to access the services, that's not to say that it doesn't connect to the whole county, the whole rural piece as well. So that's a little urban rural nuance, but if you need to kind of help understand or explain why folks are coming to those more urban centers, likely that's where your services are located.
So I'm I know you were talking a little bit about the urban context, and I wouldn't really refer to St. John as that urban, but it is urban. It is a city. Yeah. I mean, really? Yeah. From a funding perspective, it's urban.
Right.
It's urban. Yeah, there you go. So I can speak a little bit to this. And are there any folks from New Brunswick in the room?
Right here.
People? Okay, perfect. So you might know me as loud and annoying. So that has been my mechanism for getting really in the face of our government. Has very much been data or advocacy through data. So if the data are telling me that something doesn't make sense, I'm very vocal about it. I call the CBC. This is a hot issue right now. They want to know about it. I get on the radio, I talk about it. And then next thing I know, I have a politician emailing me, right? So I think that there is everybody's talking right now about the housing crisis. Everybody's talking about the homelessness crisis. And we all know in this room that it's been going on forever. But, now is really the time where you can say, look, there are some problems here that we need to discuss, and I've got a new lens. And there's some great ways that you can do that with publicly accessible data through StatsCan. And again, I can reach out to your local university or send me an email and I can walk you through some of it. You can show your government trends over time, and they're not looking at these things. Yeah. And they should be. So you'll show them this and they go, oh, wow. Yeah. I didn't know that, and you have their ear. So there's a great way to use some really simple data advocacy techniques that your local university should know about. And if they don't, reach out to me and I'll connect you.
And I'll just say, I can invite you to the November 23rd advisory committee, and you can take over that committee.
There you go.
Yeah. Seriously.
We have 5 minutes left for any closing remarks.
Thank you.
Yeah, more than anything, thank you all for coming to this session. I think most of us, aside Brenda, I didn't meet you beforehand, but I know most of us have worked together because Nova Scotia is a small place. It fits many times in Ontario, and so we all try to really work hard together. And so thank you all for coming, and to my fellow researchers and friends here that we wouldn't be able to do this without collaboration across the province either.
Sorry, I'd like to add one more comment. I think sometimes when you think about a service-based count and the way we've set it up, it looks like a lot of work on providers. And it certainly does put a lot of work on the service providers. And I think we need to give credit there. That said, my colleague Catherine and I, when we were thinking of doing this, she says, should we do another one? I said, I don't know. It's a lot of work for them. She says, I don't know. Maybe we should bring it up at our working group. And we did. And unanimously that day, everyone was like, no, this has to happen. And it's because like what they get out of it is huge. And I think this needs to be stressed because sometimes, especially if you're not familiar, you're sitting back and you're thinking, oh, this is a lot of work. And it's no question, it's a lot of work for those providers. But they're also really advocating to have it happen again 2 years later. And they felt unanimously this was a really important thing. It's good for their funding. It helps them to be able to advocate for themselves better because we're willing to, do the data crunching and then they get what they need. And we create infographics from it. We try to make sound bites for politicians to be able to appeal to them and to the community so they understand homelessness in their own community, that these are their neighbors, that these are the people that are part of their community. They're not external to it. These are their neighbors. And I think this is like key. So if I have one last thought, it's really that. It's that, yeah, it's work and yeah, it's work for everyone involved, but it's work that our community consistently says they still want to do. And Cape Breton's been doing this since 2016, I think. Yeah, like long before I've been there. This is my first count coming up, but this is a long-standing thing in our community and the value is emphasized. So.